Yeah, so one of the projects I've had the pleasure of being a part of is a large Chicagoland consortium focused on disparities in myeloid malignancies. So we've done previous work in acute myeloid leukemia, demonstrating the impact of structural racism and air pollutant exposure in terms of drivers of disparate outcomes in patients with AML. We wanted to transition a lot of that work into looking at patients with myelofibrosis as well. So ultimately, a cohort of about 500 patients was identified. And within that cohort, we looked at patients who identified as non-Hispanic white, non-Hispanic black, or Hispanic. And what we found was across this cohort, our Hispanic and black patients had higher rates of primary myelofibrosis as compared to secondary myelofibrosis when compared to our white patients. We also found that when using our traditional risk scores, it seems that risk stratification was fairly similar based on race ethnicity. The major drivers of disparity that we found was JAK inhibitor receipt. So black patients had significantly lower rates of receipt of JAK inhibitors despite having similar rates of high-risk disease when compared to white and Hispanic patients. We did find similar rates of allotransplant, which is quite encouraging within this cohort. And then lastly, when controlling for age and gender, we found that our black patients had poorer overall survival when compared to our white and Hispanic patients, suggesting that even if we're looking at cohorts of patients that have similar risk disease based on our traditional risk scores, there are still barriers to care that are popping up, whether it's receipt of JAK inhibitors or whether it's that these risk scores, which have been developed in largely homogeneous populations, may not actually be the best for more diverse patient populations. So further work is ongoing to characterize whether risk stratification using things such as DIPS and MIPS is applicable for black and Hispanic patients, and whether things like insurance status and census tract further influence the outcome of these patients.